operating room, the most dangerous thing is not the scalpel. The most dangerous thing is assumption. And to prevent assumptions, we use something very simple but very powerful, the WHO Surgical Safety Checklist. Hello everyone, I am Dr. Sandesh. In this video, I will explain the WHO Surgical Safety Checklist in a very simple and practical way. This video is especially useful for medical students, interns, nursing staff, and junior doctors who work in the operating theatre. The Surgical Safety Checklist is a tool developed by World Health Organization. Its main purpose is to improve patient safety during surgery. It helps the entire surgical team confirm critical steps so that errors like wrong patient, wrong procedure, or wrong surgical site can be avoided. It also improves communication between the surgeon, anesthetist, and nursing staff. The checklist is divided into 3 important phases. These phases are followed at different times during surgery. They are sign in, time out, and sign out. I will be telling you guys a very easy way to remember all this in a form of mnemonic once all 3 phases has been discussed. The first phase is sign in. This is done before anesthesia is given. Point 1. At this stage, the patient's identity is confirmed by checking name and hospital number. The consent form is checked and verified. Point 2. The surgical procedure and the surgical site are clearly confirmed. Other things checked are: Point 3. Is the anesthesia machine and medication check complete? Point 4. Is the pulse oximeter on patient and functioning? Point 5. The team confirms whether the patient has any known drug allergies. The anesthetist also checks for any airway difficulty or risk of aspiration. Point 6. If significant blood loss is expected, that is more than 500 ml, or if child more than 7 ml per kg, availability of blood is confirmed. This step is extremely important because once anesthesia is given, correcting mistakes becomes much more difficult. The second phase is called time out. This is done just before the skin incision is made. During time out, the entire surgical team pauses for a few seconds. Everyone in the operating room is involved. Point 1. The surgeon, anesthetist, and nursing staff introduce themselves by name and role. Point 2. The patient's identity, procedure, and surgical site are again verbally confirmed. Point 3. The anesthetist confirms that antibiotic prophylaxis has been given within the correct time, that is within the last 60 minutes. Point 4. For anticipated critical events, certain questions are asked. First, to surgeon. What are the critical or non-routine steps? How long the case take? What is the anticipated blood loss? Now remember, this is a potential MCQ line. Remember, anticipated blood loss is by surgeon and actual blood loss is calculated by anesthetist. Questions asked to anesthetist: are there any patient-specific concerns? And to nursing team: has sterility been confirmed? Are there any equipment issue or any concerns? Point 5. Availability of imaging such as X-rays or CT scan is also confirmed. This pause improves teamwork and ensures that everyone is mentally prepared before surgery begins. The third and final phase is sign out. This is done before the patient leaves the operating room. The nursing staff verbally confirms name of procedure, instrument, needle, and sponge counts are correct. Specimen labeling and reading specimen and patient name allowed. Whether any equipment problem is to be addressed. The surgeon discusses any intraoperative complications if present. The post-operative plan, including recovery and further management, is clearly communicated to the team. This step is crucial in preventing retained surgical items and post-operative confusions. Here are easy, exam-friendly mnemonics for WHO Surgical Safety Checklist, perfect for Viva, OSCE, teaching, and word recall. As we know, checklist has 3 phases. Remember it as in, pause, and out. In is sign in, and pause is time out. As in sports, when we say time out means we are taking pause. Here, in this phase, patient is operating is on operating table, so everyone taking pause. So that is time out. And out is sign out when patient is moving out from the operating room. To remember sign-in components, remember a mnemonic Piper A. That is P. Patient identity confirmed. I. Informed consent. P. Procedure and site marked. E. Equipment and anesthesia check. R. Risk of difficult airway and aspiration. A. Allergy check. Also remember IV access monitoring pulse oximeter. For timeout, remember mnemonic team pause. T. Team introduction. E. Expected critical events. A. Antibiotic prophylaxis. M. Marked site confirmed. P. Patient procedure position confirmed. A. Availability of blood and imaging. U. Unique concerns discussed. S. Sterility confirmed. E. Equipment ready. For sign out, remember mnemonic score. S. Sponge and instrument count correct. C. Correct specimen labeling. O. Operative procedure recorded. R. Recovery concerns discussed. E. Equipment problems addressed. The WHO surgical safety checklist has been shown to significantly reduce surgical complications and mortality. It is not just a formality. It is a safety culture tool that encourages communication, accountability, and teamwork. Even experienced surgeons can make mistakes, but a checklist helps catch those mistakes before they harm the patient. One common mistake is treating the checklist as a routine tick box exercise. The checklist should be spoken aloud and actively confirmed by whole team. Patient safety depends not on how fast we operate, but on how safely we operate. To summarize, the surgical safety checklist is a simple but powerful tool that saves life. Whether you are a student, intern, or a surgeon, make it a habit, not a burden. If you found this video helpful, please like, share, and subscribe to the channel for more surgical teaching videos. Thank you for watching.